When he asked me, I said, what is the chance that I was going to survive? And he said 50-50.
When Ann Brown was 54, she was diagnosed with colon cancer.
And I was so frightened. I cried and cried and cried.
Colon cancer does affect many Canadians. It is diagnosed in over 22,000 Canadians per year. It kills almost 9,000 Canadians per year. So in terms of impact, in terms of patients, their family, it's certainly one of the most devastating cancers to be diagnosed with.
As a leading gastrointestinal oncologist, Dr. Clarence Wong knows that people are dying unnecessarily from colon cancer and that screening can save lives.
Colon cancer screening is one of the best ways to protect yourself from getting colon cancer. One of the issues is that because cancers grow and begin as small polyps, and these polyps can take a long time to form into cancer, if you can catch them at the earlier stage, you can remove them and essentially prevent cancer from occurring. So everyone should get screened once they're age 50, and that's men and women, obviously. The best time is when you're going to see your family doctor for your annual checkup. We'll talk about colon cancer screening. Now, if you have a family history of colon cancer, screening might actually happen much earlier, so we'll talk to your family doctor at an earlier age.
I got screened for colon cancer just as part of my annual physical. And it turned out that there was blood in the sample, and as a result I was referred for a colonoscopy.
In Canada, we actually have many options for colon cancer screening. A lot of these can be discussed with your physician, but it can entail a number of things. One, it can be as simple as doing a simple stool test to look for small amounts of blood in your stool. You can be sent for endoscopy, so in that case you would be sedated and a colonoscopy would be performed to detect and remove polyps. And all these may be available just talking to your physician about this.
Once it was done and the results were in, I actually felt relief, as it was a good outcome.
No one should be dying from colon cancer, as regular colonoscopies have the highest chance of detecting and removing precancerous polyps.
Right now, in the provinces, only between 4 to 20% of people that should be screened are getting screened.
The reason why I even got the screening done was because I had blood in my stool.
If you find colon cancer in an early stage, it's over 90% curable. If you find it at a later stage, it means more treatments.
He booked me for surgery right away, and he said, you will have to have chemo.
So the best time to catch one of these cancers is at the earliest stage. Better yet, catch it when it's a precancer or a little polyp, move it, and it's gone.
Why didn't I do this before? I'm a nurse, I should have known. But when you don't have symptoms, you don't tend to even think about it.
Dr. Wong is a member of the President's Council of the Canadian Digestive Health Foundation. The CDHF is a national charity dedicated to providing Canadians with accurate, compassionate, science-based information that empowers them to take control of their digestive health with confidence and optimism.
We're looking to reduce the number of people diagnosed with digestive illnesses. We're looking to improve the quality of life or to reduce the symptoms of those people that have digestive diseases. And overall, we're looking to support and to enhance the quality of life of those people that have digestive illnesses.
That includes raising awareness about how to reduce your risk for colon cancer.
Certainly, if you eat well, a balanced diet, high in fiber, and the other is to stay fit. So activity, more than 30 minutes 3 times a week has been absolutely shown to reduce the risk of colon cancer.
I tend to exercise a lot more. I've hired a personal trainer that I work out with.
I still think the most important is to talk to your family physician and to get screened.
Before I had this colonoscopy, I was afraid that it was going to hurt because I'd heard other people say it's really unpleasant. But there's nothing unpleasant about it.
Anne now knows that getting tested can save lives and recommends colon screening to her friends and family.
Because I encouraged them, they went and had a colonoscopy and they discovered cancer.
Detecting colon cancer in an early stage through screening has a number of advantages. I think the most important is that it increases chances of survival.
It ended up that they had no chemo because they caught it in the very, very early stages.
I think the most important message about colon cancer screening is just get screened.
If it's not being done regularly, your doctor's not offering it, you should ask for it because ultimately this is your life and you need to take control.
For more information about screening for digestive cancers and protecting your digestive health, visit cdhf.ca and then speak with your doctor.